So, hi everyone. I am very, very delighted to have with me a very dear student, Ameya Machave. He is, he has secured an amazing rank 49 in INICET May 2023. So, heartiest congratulations, Ameya. How do you feel?
Thank you so much, ma'am. Really happy with the result. Luckily, our result was on the same day as our convocation ceremony. So I
Wow.
was lucky to have my parents and all my friends with me when the result was out. So it was a great moment for me.
Wow, that's like the best time for the result to be out, when
Yeah,
everybody
ma'am.
can see you shining. So that's great. So that calls for a double party, Ameya, then.
Sure, ma'am. Sure.
Great. So Amya has been with us for a long time. You've been a 3-year student with us, Amya, if I'm right. Great. So,
Yes, ma'am. I
we
was
would,
a foundation batch student.
yes. So I really want to know, Amya, that when you started your preparation and coming this far, how did you sort of change your strategy? What was your goal initially? And how did you keep changing it as you kept coming closer to the exams?
Yeah, ma'am. So when I started my MBBS journey in first year, in first
Yeah.
and second year, the predominant focus was to go through the standard textbooks of the
Hmm.
first and second year subjects. So that really set a base and a foundation, which helped me in the third minor and major clinical subjects.
Great, great.
So after having done with first and second year by reading the standard textbooks, in third minor I had joined DAMS as a foundation batch student at DAMS Mumbai. So we started
Fantastic.
attending the offline lectures, and then after the lockdown was there, most of the lectures had to be shifted to the online platform. So throughout the
Right.
lockdown, I had completed attending the lectures and making notes
Okay.
for majority
Wonderful.
of the subjects.
Okay.
Only one or two subjects like short subject were left behind, which I completed in the final year. And in third minor itself, I had made sure that PSM, ENT, Opthal, I should be thorough with. And then
Okay.
and for the final year subjects, I made sure that at least once I had gone through the notes of medicine and obs gynae.
Mm, that's great.
And
So I
then
think that is a good
when
strategy,
yeah, ma'am.
because you were ensuring that you had a strong content in the same professional year itself. And that is,
Yes,
I
ma'am.
think, a very good thing to do. Because you should take it like that, that if you are in third year, you should do the third year subjects as if you're doing them for the last time. If
Yeah,
you're in the
ma'am.
fourth year, that's how it should be. So I think that must have given you a little push in your internship year, right?
Yeah,
So,
ma'am.
did you do the TND in the internship year, Amya?
Yeah, ma'am. I started during the internship. I started reading notes, and with
Okay.
the first and second reading, I gave TND. I could not complete for all the subjects, but I made sure that for the clinical subjects as well as the second year subjects, which have the
Fantastic.
majority of questions, so I had given the test and discussions for those subjects.
Okay. That's great. And मुझे बताओ Amya, what special things did you include when we talk about INICET exam? Because this paper was a little atypical from the previous year papers.
Yeah,
So,
ma'am.
what do you think, was your USP that ensured that despite a change in the strategy of the paper being atypical, you could do so well. Coming in the top 50 is not an easy task, right?
Yeah, ma'am. Ma'am, I felt that this year's INICT paper was a lot about your presence of mind at the time of the exam and your ability to rule out questions. So I
Okay.
think giving grand tests throughout my preparation during my internship, as well as during the last stages, giving the mock test and solving as many as questions as possible is something which helped me, because the during the exam the most important thing was, even though you know only 20% about the topic, still somehow you should be able to rule out options so that you are left with only two options, and then you can go with your gut instinct and solve the question. Because I think for INICT around 100 questions were easy. Like if you have done the basic preparation well, you can always solve those questions. But then after that, a
Fantastic.
lot was about how you were able to use your presence of mind, how you were able to rule out your options. So I think sometimes while during our preparation, a particular grand test is tough or difficult. So sometimes we just leave it कि ठीक है इस इतना एक difficult exam का paper तो नहीं आएगा. But
Right.
then if you give that, if you try to solve those questions, then that helps in the questions of INICET where the questions would are tough, and even though you don't have the knowledge, somehow you are able to rule out options and try to find the best answer possible. So I think that question solving practice really helped me, and I mean, not giving away just a difficult question or paper and trying to give my best possible answer for that question. So that practice really helped me during this year's particular INICET exam. And yeah, the PYQs were less, but again, going through the PYQs once, that also really helped me.
ग्रेट आई थिंक आपने बहुत ही वाइटल पॉइंट बोला है अमेया सो आई एम गोइंग टू एक्चुअली रिपीट इट यू नो अ लॉट ऑफ टाइम्स पीपल विल मेक अ ग्रैंड टेस्ट जस्ट टू मेक द स्टूडेंट हैप्पी you know we at dams
Yeah, ma'am.
ensure that we have a very mixed bag when it comes to grant test. Every faculty is contributing the questions. They are ensuring that you have some easy ones, you have some mediocre ones, there are some where you need to think as well, so it has to be a good mix and match so that you know ऐसा नहीं होना चाहिए कि when you're giving GTs you feel oh you were getting 160 correct and suddenly in the real exam you realize that it didn't happen that way. So this one thing that you said, that even if you don't know a question, this you have to keep it in mind that if you have a good base, a good knowledge of your content, you should be able to rule out some options, and as you said, go with the gut instinct with the others. So hats off, Amya, because I think that is the real exam strategy that counts. Yes, as you said, it was about those 3 hours, it was about how you
Yeah,
could
ma'am.
use knowledge. Now, Amya, can you also tell us, beta, something about subjects which, let's say, someone is preparing for the November INICT? Can you, if I ask you, suppose you were again giving the November exam,
Yeah.
what would you plan? What would you exactly do in this time, and how would you do? What subjects would you actually stress on, and things like that?
So after going through the PYQs of INICT for the last 5 years and even this year's INICT, I realized that uh, first and second year subjects are important, especially microbiology was very important for this year's INICT, and topics like opportunistic infections in immunocompromised patients. So it has been asked every year, and even in nowadays they are asking more of those questions in the NEET exam. And in our exam also, we had at least 3 to 4 questions where the scenario was patient was immunocompromised and he had some of the other opportunistic infections. So I think the strategy for November INICT should be first go through your notes once, get the basic knowledge and basic reading of the notes once. After that,
Yes.
go through the PYQs from many of the source. At least I would say last 7 years PYQs of AIIMS and INICT. And as you solve the PYQs, make a list of the topics which have been asked frequently. Like say, as I said, opportunistic infections in immunocompromised patients, and
Right.
make sure that that particular topic you have done well. If you find that that particular topic is not there so much in notes, then for that particular topic you can open a standard textbook like Harrison's and just make 1 page note for notes for that particular topic, so that during the last 10 to 15 days of your preparation you can make sure that last 7 year PYQs, all the important topics, you have concise notes to revise. And along with that, giving grand test at frequent intervals like 15 to 20 days initially, and then every week during the last 1.5 month of preparation. I think that would really help because in INICT, certain topics are asked more. Like even in biostats, this year the questions were really tough. So
Yes.
those topics, I mean, rather than doing everything in great details, for INICT, I feel making the list of the important topics and doing only those topics in great detail. That if any question is asked again related to that topic, I should be able to do it.
Okay. Great. So that sounds good. And now, Amya, I also want to ask you, since we all know that, as compared to NEET, INICT has more weightage for first and second year subjects.
Yeah, ma'am.
Although this year, again, those subjects were clinically asked, not as
Yeah,
individually asked. But
yeah,
I want to ask you, if I think that I am a student and I want to prepare, I would love to ask a senior like you, ki, sir, subjects like pharma, micro, biochem, sir, they are very volatile. I can't retain them. So, what
Yeah.
would be your suggestion on how to tackle this?
I think even initially when I was preparing during my internship, certain topics of biochem and microbiology, even I find tough just to read it from the notes and remember. So for those topics, I made sure that I again went to the lecture. Sometimes what happens is we have attended the lecture in third minor or major, and then we are directly reading the notes during internship. Then it
Right.
sometimes certain points just don't click, and then we just keep on just rectifying those points. So I think
Mhm.
whichever topic you feel that you are finding it difficult to remember or understand, I think it is always better to quickly go through the lecture of this topic, because then certain words that the professor or teacher tells you, they get ingrained on your mind, and then you don't forget
Yes.
them.
Yes.
So I think that is one thing that really helps. Whatever topic you find difficult, go through the video again. And secondly, as you revise side by side, you can make a notebook of the points that you frequently forget, or you frequently go wrong about. I believe that the entire preparation is about how you can make the content concise enough, which you can revise in the final 15 days, especially for the volatile topics like pharmac, biochem, micro, and the shorter subjects, because the content is a bit more, and it's difficult to remember. So trying to make the content as concise as possible so that it is revisable in the last 15 days, because whatever you are going to read in the last 15 days, you are going to remember it fresh during the exam. And subconsciously the answer would pop up in your mind after reading the question. So making your content concise, going through the lecture for the difficult topics, and whatever you forget, make a separate notebook for it, because when we read the notes from first page to last page, then at the end sometime we miss something, like specifically we are not able to focus and remember a particular thing. But when we have
Yes.
made a separate notebook of the all the points that we forget, and when we are reading it again separately, then each of the point again is highlighted there, and then we do not miss it. So I think that is what would help for the volatile subjects.
Great. So I think that information would be very, very useful for someone to plan and how to tackle those volatile things. And lastly, in the strategy part, I would like to ask what exactly did you do in, let's say, last 15 days or last 1 week? And do you think DVT was useful even for INICET? We know it had a huge hit rate in NEET. And, what about
Yeah.
typically for INICET as well?
Um, yeah, actually, after the NEET exam, I was happy with the results. So I did not prepare so much for INICT. What I had done was I had gone through the PYQs and had given a one mock test for practice. So I think whatever I had done for the NEET exam during my prep, I
Okay.
think that helped me for INICT as well.
Yes.
Because initially when I was reading during the internship, I was reading a subject as such and not focusing on one particular exam. Only
That's
during
how
the
it should
last
be.
one and a half month, yeah, during the last one and a half month, I focused on need specific topics and points. Uh, and that is why the entire preparation helped me in INICT as well. And yeah, as you said, ma'am, the DVT was had a very high strike rate in NEET, but I think the concepts helped in INICT as well. Especially, I think the pharmacology content, ENT content was quite in depth in DVT as well. So, and even shorter subjects like psychiatry and anesthesia, the content was such concise yet exhaustive that. Uh, Even if you are not able to read the notes, even if you just go through DVT and go to the exam, you would be able to solve at least 4 out of 5 questions. So I think
Correct.
whatever DVT I had read during the NEET prep, that really helped me, especially for subjects like pharmac, ENT, pathology. Uh, so that content helped me in INICT as well. And I think the last 10 to 15 days preparation for any exam should be whatever content you have read throughout the year, that should be made concise. And while the second or the third reading, make sure that you cut the points that you know that you are able to remember and solve questions, and star mark or highlight the points that you frequently forget or get wrong, so that during the last 15 days you have a concise matter that you can read, revise, and so that you go confident in the exam and you can freshly remember those. So for I think for INICT, the last 15 days strategy should be go through all the PYQs, go through all the points that you forget, give two grand tests for practice, and I think that would suffice.
Wonderful. And now, Amaya, let's come on to the last part, that is the exam day. So, can you tell me
Yeah,
how
ma'am.
aggressive did you go in the paper? How many questions do you think were right? How many did you keep for review and your time management?
Yeah, ma'am. So, ma'am, I would start with one day before the exam for NEET as well as INICET. I think being confident a day before the exam is very important. So, I would say one day before the exam, I would say from the afternoon onwards, read only the topics which you know you already are good in that topic. Because
Okay.
even though you might not add to your knowledge, but then that gives you a lot of confidence. Like for even
Absolutely.
before NEET exam, where I knew that I was strong in medicine. So what I had done was I went through the topics of medicine on the eve of the exam in the evening. So by the evening, I was confident, okay, that I prepared well. I'm able to remember things, recollect things, and I would be able to solve questions. So that helps to convert the anxiety of the exam into excitement. Then, rather than being
Mhm.
anxious, you are excited to go there and solve questions aggressively. Go with your gut instinct and solve the paper. So I think one day before the exam, read only that which you already know, so that you feel confident. You're excited about the exam rather than being anxious. And on the day of exam, I feel that initially 20-25 questions, even if it takes a bit of time to get into full flow and full concentration. So you can just for unsure questions during the initial 25 questions, you can mark them for review, so that when you are in full flow, when you have settled down, you can again go through those questions. For INICET exam, what I had done was I tried to attempt all the 200 questions at least once within
Mhm.
2 hours and 15 minutes. So I had 45 minutes left behind.
Okay.
After that, which I went through the marked for review questions and the question that I had not attempted. And then I gradually kind of again, so in the 20-25 minutes, I went through those questions once. Then again, whatever time I was again and again narrowing down the questions and solving them. In this year's INICET, I felt that at least 10 questions were such that they were very difficult to attempt or solve. Like the topics were very new, or there was a less chance that we could guess the answer and get it correct. So I had attempted around 190 questions and left 10 questions. Uh,
Okay.
like there was one question on the nomogram of vancomycin, and even some certain biostat questions were really difficult. That if you don't know the formula for that particular index, there is no point in attempting that question.
Yeah.
So I had left around 10 questions and attempted 190. I think depending upon the paper, any question, if you are able to narrow down to two options, then go with your gut feeling and go for the question. Because let's say even if there are 15 such questions, and even if you get 6 to 7 right, still you are going into positive marks. And if you go with the gut instinct, you're prepared well throughout, then more often than not you would get at least 7 questions out of those 15 questions right. And then overall that is going to profit you a lot with your score. So I think going aggressive with any exam is very important. Go with your gut instinct, especially when you are able to narrow down to two options. And you can go with your gut instinct confidently when you are confident a day before the exam and you are excited to go ahead and solve the paper the next day. So I think that last day preparation and going aggressively into the paper, but at the same time making sure that certain questions it is important to leave behind as well, because in INICET the weightage of negative marks is a bit more as compared to NEET. So I think that
Okay.
helped me in my the exam day.
Right. So that's a great wind up from when you started to where you have reached, and a very, very diligent worker, Ameya. I must congratulate you on your persistence and hard work. And now
Thank you,
tell me
ma'am. Thank you, ma'am.
which branch do you want to pursue?
Ma'am, mostly I would be going with MD medicine. So now
Okay.
both with the NEET as well as the INICET result, I would apply for the best colleges from both the exams. And I think
Absolutely.
I'm also thinking of going and visiting to the colleges of Delhi and AIIMS and PGI, so that I can uh, make the best decision. But yeah,
That's
mostly
the
MD
right
medicine is the branch that I'm going for.
Wonderful. And I'm sure you're going to be a great, great doctor contributing a lot to patient welfare and treatment. So, wishing you a very, very bright future ahead, Ameya. The entire DAMS family is sending you blessings and good wishes. And we hope that you keep shining like this always and you keep smiling like this always.
Thank you, ma'am. Thanks a lot. I would like to extend my gratitude to the entire DAMS family, Dipti ma'am, you, Sumesh sir, and all the faculties. From third year onwards, we had started doing with the dance lectures, and those notes helped us in the university exams as well. So I think right from third minor onwards, the faculties have always been with us, supported us, not only academically but also non-academically, encouraging us, always boosting our morale. So really, thank you to you, Sumesh sir, and all the team for their constant support and guidance throughout our MBBS journey.
Thank you, Bache.
Yeah, ma'am.
Wishing you good luck for your future. Thank you for making us a part
Thank
of
you,
your
ma'am.
journey. Take care.
Yeah, thank you.